Assalamu alaikum wa rahmatullah. This is the last lecture of EduBlock. The title of the lecture is Health Profession Report. We'll try to answer 4 objectives in this lecture. The first objective is why medical records are important. So let's start with the definition of health record. Health record is any relevant record made by healthcare practitioner at the time or of a consultation and or examination or the application of a health management. What constitutes a medical record? Any clinical notes, handwritten or typed, any scan document, consent forms, lab results or X-ray reports, any printout from monitoring equipment like ECG or EEG, written communication with the patient like emails. Why it is important to keep records, to remember things and to plan for the future of diagnosis or any ongoing clinical management of the patient, and to provide a safe and effective care, to improve the accountability of how decisions are done for the patient care, and also to promote teaching and research. You know that if we want to do any research, then we need to review the medical records, and to make case reviews possible. Also, if there is any accreditation of the hospital, they will review the health care records or medical care records, and it will be used by the administration for their purposes. And if there is any medical legal issues, legally things which is not documented is not. The second objective is the guidelines of medical records keeping or report writing. Documentation medical records has to be accurate, or documentation medical records has to be accurate, complete, timely, readable, well organized. We have to use the approved abbreviation. We have to write the date and time with every entry. You should not leave spaces or pages. We have to use the appropriate forms, and we have to follow the institutional policy and guidelines for charting. If there is any error, then you have to correct error using the proper technique. And of course you have to sign with the name and your pager or code number, and then also using the time. When there is 2 types of timing, the military timing or the standard timing. The standard timing is when we say 1 AM meaning 1 صباحا، مثلا 3 PM يعني 3 بعد الظهر. where the military timing is 24 hour. فإذا قلنا مثلا 13 hour معناته 1 PM، إذا قلنا 15 hour يعني 3 PM. هذا الديفرنس. بعض المستشفيات تستخدم الستاندرد تايمينج وبعض المستشفيات تستخدم الميليتري تايمينج. So medical records, what it should use, or what's the contents of medical records, including the personal information of the patient, history and examination, the time and date and place of every consultation, assessment of the patient condition, any management done, and so to include also any planned clinical management of the patient, medication, and of course doses prescribed, any adverse reaction for the patient, the lab results and X-ray results reports has to be in the file, and details of referrals to any specialist, or if there is informed consent has to be also available in the files, and you have to justify in writing the decisions or reasons for your decisions. Of course, we should not do any changes or in the records. No information or entry may be removed from the health records. If there is any errors, then it will be corrected in the according to the policy hospital. The second objective is to describe the different forms of medical records. There is 5 types of documentation. The first one is the problem-oriented medical records. The second is the source-oriented record. The third is the standardized care of plan. And the fourth is the discharge summary. And the fifth is certificate of illness. So let's start with this type. It's called problem-oriented medical record. The data are organized and the chart is organized according to the problem, or what we call problem-based documentation. So you include the database, the problem list, and the database will include the history and physical examination, nursing assessment, ongoing and daily assessment, and of course lab and radiology results, and record of each hospital visit. And it includes really the problem list according to the chronological order, so the most recent data will be in front of the chart. We use the term SOUP for the previous note. S for subjective data. It is what the patient says or state. Objective, what is your finding? It's like the examination finding, the signs. Assessment is the diagnosis or problem based on these data, and the plan action to be taken. Also there is, you can add IE, intervention, and evaluation. BIE charting, P for problem, I for intervention, and E for evaluation. This is another way of writing the note. The second type of medical record form is called source-oriented records, where the chart is organized according to each discipline or each section. So every section is separate. So the nurses have their sections, physician has their section, and lab has its section in the file, and radiology, and so on. And the disadvantage that it results in fragmentation of the patient. And then there is a form called standardized care plan. This is a pre-printed established guidelines for the care or the plan of the patient. This is really recently we start to use it in a special situation like in oncology patients, and maybe acute emergency in the ICU, and so on. The fourth form is called discharge summary forms. Of course we do it and we write it at the time of the discharge. We do it in handwriting. We give a copy to the patient, and of course the typed copy will be in the chart will be ready in few days or weeks. And then of course the certificate of illness, like discharge, like the sick leaves or medical records of the patients. And now we'll move to the computerized record keeping. Every hospital almost they have an electronic system to document the patient care. In National Guard Hospital we have something called Best Care system. We adopted this paperless electronic healthcare system, which is Best Care. This is one of the best available system. It's a user friendly, and it advantages that it will give unified database. You can use it in the e-consent and also for smartphone applications. The other benefits, it's ease of use, uniformity, accuracy, accessibility, and also improve communication between the records and the patients, between the doctors and patients, and between the healthcare each other. When there is a communication between the healthcare worker, we call it multidisciplinary communication. It could be verbal communication at the end of the shifts, or it could be written. between the nurses or healthcare worker at the time of the shift, or when the on-call team will report to the next team the patient condition. So it's written at the end of the shift report. There is something called telephone orders. We accept telephone orders in the healthcare on calls, but in a very limited situation. The physician and nurses, of course, there is a telephone order, but has to be limited to avoid errors. One of the possible errors is the incident reports. When we say incident reports, is any events occurred to the patient not considered part or part of the routine of the patient, like falls, needle stick, medication errors, accidental omission, or extra dose given, or injury to the patients. Of course, there is a special documentation has to be done for the errors. When one of the technique of communication is called SBAR. S for situation, P for background, A for assessment, and R for recommendation. And there is really explanation in these two SBAR. The last part of the lecture is common problems in report writing. Report writing is often given a low priority, although it is one of the most important action to be done for the patient. The second problem is not following a standardized model, like every healthcare worker is doing documentation according to his own. This is really not acceptable. Missing one of the other common problems by missing informations, unclear information or inaccurate spelling mistakes, absence of patient identification for like the medical number or the name of the patients, or failure to document given of the patients, or failure to record the telephone calls, or failure to record the action taken for the problem happened with the patients, or failure of communication between the healthcare professional, or using inaccurate terms or unapproved terms like a jargon. And with that we completed all the 4 objectives of this lecture. I hope you will benefit from this lecture, and thank you for your attention.